We're a couple months into 2026, and already the Centers for Disease Control and Prevention is reporting more than 900 cases of the measles nationwide. Dr. Ambreen Malik with the University of Michigan Health Sparrow joins us on Mid-Michigan Matters to share more. Dr. Malik, while Michigan is not one of the states that is reporting the highest number of cases, why should families in Mid-Michigan still care and pay attention to the measles cases?
First of all, I would like to say thank you for giving me the opportunity to talk about this spreading disease. So, although we are not seeing much cases in Michigan, but we should still be very careful because, you know, we are traveling to the areas where outbreaks might be expected or they are confirmed outbreaks. So, travelers, especially unvaccinated travelers, should be very careful. And even if you feel like you are not vulnerable to disease because you are vaccinated, but you might have people around you, or especially in your family, your dear ones, like you might have a pregnant person in your family, or you might have a newborn who is too young to be vaccinated. So we should be careful about our dear ones, about our people around us.
We hear all the time one of the best practices or things to do to prevent catching a case is by getting a vaccination. But you're saying in some cases too, getting the vaccination might not even be the only way to protect yourself. What are other prevention methods so people don't catch a case or the symptoms of measles?
So there are a few ways which are worth mentioning. First and foremost important thing is hand hygiene and isolation. This virus is considered to be on surfaces and it can stay on the surfaces for up to 2 hours. So hand hygiene is most important. Try to avoid surfaces, especially in the public areas. And if you are touching the surfaces, of course, it cannot be avoidable 100%, but then try to avoid your eyes, nose and mouth because contaminated hands, when they touch these areas, people can get infection. It is airborne virus, so it can stay in the environment. Even if the person leaves the space, it can still stay there for 2 hours.
Wow, so this is very contagious and something for those who are vulnerable too, like babies, the immunocompromised, maybe older adults too, to be careful for their health.
Yes, and once you catch this infection, or if you are suspecting that you might be exposed to potentially measles positive patient, then always try to reach out to your healthcare provider and let them know about your concern that you might have exposed or you might have symptoms.
Dr. Malik, thank you so much for joining us.
You're welcome. Thank you.